Welcome to my presentation. I am Bachar Fakhri and will be presenting the paper titled The Covid-19 Pandemic Uncertainty Behavioral Factor Model. The presentation will firstly introduce the topics at the heart of this research, which are the impacts of the Covid-19 pandemic and the uncertainty behavioral factor model, moving on to a review of Covid-19 pandemic and the UK's government response, continuing to review the economics factors. Next, we derived the uncertainty behavioral factor model to analyze the impact of the Covid-19 pandemic on the markets and review the reactions of the market participants. Finally, we conclude with a review of the model and concluding remarks. On the 31st of December 2019, the Chinese authorities notified the World Health Organization of an unknown virus. The Covid-19 pandemic was the biggest health issue since the Spanish flu pandemic of the late 1910s. Since its discovery in Wuhan, China late December 2019, there were 10.27 million cases and 505.63 thousand deaths globally, as reported by the European Centre for Disease Prevention and Control as of the 30th of June 2020. As we will see later, a key date was the upgrade of Covid-19 from epidemic to pandemic status on the 11th of March 2020. Many countries went into lockdown in an attempt to slow down the rate of infected cases. This had a huge negative impact on their economy, which were reflected on the financial markets. The economic impact is projected to be more devastating than the recent financial crash, with these economic consequences. As stated previously, the 11th of March 2020 Covid-19 upgrade shocked the markets, causing a crash on the global equity markets. The key contribution is the introduction of the uncertainty behavioral factor model, which is derived to illustrate the impact of the internal and external factors on the behavioral reaction of market participants during any crisis. In order to better understand the behavior of market participants during the pandemic, we derive 4 new heuristics and biases. We also contribute with our emotional and cognitive analysis of market participants and their reactions during the Covid-19 pandemic. As illustrated here, there are 2 variants of the coronavirus, the MERS and SARS. The Covid-19 virus is a variant of the SARS coronavirus, illustrated here. Further, the Covid-19 virus is a highly infectious zoonotic virus with an R0 of between 2.0 and 2.5. As illustrated by the picture, the Covid-19 virus is thought to have originated in bats in central China. In 2018, as illustrated by the slide, there were a number of articles published which in essence were warning that human-animal contact due to deforestation could lead to a major health crisis. The zoonotic nature of the virus meant that in late 2019 the Covid-19 virus was transmitted to humans via live animals at the livestock market in Wuhan. Due to the interconnected world, the virus quickly spread globally. As of the 15th of November 2020, the virus has infected 54.11 million and killed 1.31 million. Globally, government's response was substantially varied in adoption and pace. The UK's Covid-19 response was a reactive one based on advice by a group of behavioural scientists. In essence, it amounted to a keep calm and carry on approach. Medical scientists' warnings of a major health crisis in the NHS and a hike in deaths and evidence from the rest of Europe were ignored by the UK's government. The UK's policy changed in mid-March when a report Imperial College London pointed to the containment policy putting enormous constraints on the NHS, resulting in 260,000 deaths. This led to a quick reversal of policies, and on the 23rd of March 2020 a national lockdown was in place. Nevertheless, as of the 30th of June 2020, the number of cases was at 311.96 thousand and deaths was at 43.57 thousand. The UK's government was faced with a dilemma. The cost in lives of a continuation of the reactive policy would have been huge. However, a lockdown would have had a huge impact on the economy, given that Brexit was going to have a significant impact on the economy in 2021 and thereafter. However, as Ren Lewis 2020 page 109 states, it is worth saying at the start that the bottom line of all this for me is that the economics are secondary to the health consequences for any pandemic that has a significant fatality rate. Another issue was that the lockdown policy was feared to be intruding on freedom of movement, a fear that was evident in the US. However, it must be noted that a number of opinion polls stated that many people supported the lockdown policy and that the UK's policies during the pandemic were second worst only to the US. It has been long established that financial markets are primarily influenced by economic factors and news. Moreover, the Covid-19 pandemic has had a negative impact on the economy throughout the world. However, before we can address the impact of Covid-19, there's a need to analyze the impact of the coming Brexit event on the UK's economy. As highlighted by this slide, the evidence does suggest that there will be a negative impact as much as 3.0% on May's deal in comparison with staying. However, Johnson's deal could be 0.8% worse than May's deal. The problem is that a no-deal Brexit could still be the only option because negotiations on a new deal after the UK's general election are still ongoing. The impact of Brexit on economic policy uncertainty is illustrated by the graph. Interestingly, the graph also hints at the impact of Covid-19 on the economic policy uncertainty. What is interesting is that uncertainty due to the Covid-19 pandemic is higher than any TME during the financial crisis and following economic recession. The key to understanding the impact of Covid-19 is in the way that the pandemic stifles economic activity. The obvious way is through the lockdown policies, however there is a second way, which is the hike of fear, which reduces social consumption. The worry is that this fear does not deviate easily. As the graphs illustrates, the UK's economy was badly hit by the Covid-19 pandemic and resulting lockdown policy. The government and Bank of England both enacted easing policies which were aimed at protecting the economy from the damage of the Covid-19 pandemic and resulting lockdown. The likelihood is that these policies will have a significant negative impact on the economy in the near to long-term future. A key factor is the inevitable impact of Brexit, as well. Mainly due to the furloughed policies, the unemployment rate did not rise as expected during the lockdown. However, economic uncertainty leads to an increase in precautionary savings as many consumers fear for their jobs and hence income. In addition, the net wealth of households took a knock by the falling prices of assets such as shares, which also contributed to an increase in precautionary saving. These had a devastating impact on consumption, which hit retail sales. The uncertainty behavioral factor model is based on behavioral economics. Influenced by the seminal works of Tversky and Kahneman, behavioral economics maintains that it is Homo sapiens and not Homo economicus that makes decisions. Therefore, we need to take into account the psychological factors, in essence cognitives and emotions. We also need to take into account the externalities such as actors and factors. For the Covid-19, we need to account for the economics, financial, political, EU integration and health. If we are going to truly understand the reasoning behind the reactions of the market participants. Furthermore, the actions of the actors need to be accounted for because market participants are highly reactive to key actors. In the case of Covid-19, these actors include other market participants, householders and consumers and policymakers, that is the National Health Service, Bank of England and the Treasury. The key for the model is the definition of uncertainty, which we use three definitions. Black swan effect, as defined by Taleb 2008, is an unpredictable event with significant consequences that in hindsight could have been predictable. Niche uncertainty, as defined by Knight 1921, is a condition where the probabilities of a given situation cannot be determined and thus cannot be assigned to the asset. Ellsberg paradox, as defined by Ellsberg 1961, is the reaction to the ambiguity of the information during extreme uncertainty. In essence, humans tend to reject unknown risks in favor of known risks, even if the ambiguous option is more profitable. A critical factor during the Covid-19 pandemic is the market participants' perspective on losses and their reactions. Part of the explanation relies on the prospect theory of Tversky and Kahneman, 1992. It is worth noting that the prospect theory dictates that market participants are more sensitive to losses than to gains of similar magnitudes. However, during the Covid-19 pandemic, market participants tended to increasingly underweigh uncertainty, hinting at disinvestment in assets affected by the pandemic. The prospect theory relies on three fundamental behavioral traits which came into play during the Covid-19 pandemic. One of these traits is the reference dependence. It is safe to assume that many market participants used the price before the initial date of the pandemic as the reference price. So they evaluated their losses based on a pre-pandemic reference point. The argument is that the pandemic crisis changed the environment. Therefore, the reference point no longer existed. Assuming that many may have invested in a lower price than the reference point, thus they could have made a profit during the Covid-19 pandemic. However, this would have been a loss in their eyes due to the reference point. Another trait is the endowment effect. Many market participants exhibited an illusion of control bias, which meant they demanded more than they wanted to pay, mainly due to the high reference point. During the Covid-19 pandemic, the danger was that such behavior would lead to losses. Lastly, the trait of loss aversion. During the early parts of the Covid-19 pandemic, market participants were reacting to the number of countries infected by the virus. As the pandemic spread globally, market participants became increasingly loss-averse. Hence, market prices began to fall. There are two methods for explaining the cognitive behaviors. The first method is often called heuristic, which is a technique used by many to simplify the daily workload. As illustrated by the slide, the research have identified 7 heuristics. However, due to the timing, we will only concentrate on the 3 we derived to better explain the behavior of the market participants. The Brexit effect is the tendency to concentrate on Britain's exit from the EU, disregarding all other information or events. Partly due to the affinity of Brexit in relation to the Covid-19 pandemic on the event time conjuncture, but mainly due to the amplified impact on all aspects of British lives, economics and politics. There is no doubting it is the most significant change since the UK joined the EU in 1973. The irony is that both involve the EU. The impact of Brexit is likely to hit the UK's economy and therefore was reflected more than the Covid-19 pandemic in the early stages. Both politically and socially, the UK is divided on which route to take, with a hard Brexit still on the agenda. The market participants have every right to be worried about the future of investments, with possibly the double impact of a hard Brexit and Covid-19 pandemic looming. The media effect is the tendency to associate extreme events with TV, films or books. Mainly due to the Covid-19 pandemic being regarded as a black swan event, meaning there is no real reference point that people could relate the pandemic to. So people tend to relate the pandemic to media outlets which they have heard, seen or read. Additionally, the link between Covid-19 and the 1918 Spanish flu of the media is likely to have played a part in rising the fear levels. The political effect is the tendency for any actions of policymakers to influence the decision-making process. As illustrated previously, the initial stages of the Covid-19 pandemic were defined by a government policy which amounted to a keep calm and carry on approach. This approach may explain the behavior of the market participants during the early stages. As the policy changed, the reaction of the market participants reflected the change. Another critical factor is the actions of the Bank of England, which amounted to a worrisome account of the UK's economy and banking sector. However, an influential factor is the electing of a government with a leniency to a hard Brexit have influenced the market participants. Generally, a bias is a disproportionate probability placed in favour or against an investment, clouding the judgment of market participants. The cognitive bias limits the market participants' ability to deal with the information rationally. We found 4 cognitive biases, but due to time restrictions we will only detail the bias we derived. The relative time event influence bias is an extension of the availability heuristic. The bias contends that people tend to remember and thus be influenced by recent events or information. This influence diminishes with time. As suggested earlier, due to the affinity of Brexit in relation to the Covid-19 pandemic on the event time conjuncture, the influence of Brexit was strong during the pandemic. Emotional biases refer to the inability of market participants to separate emotions from investment decisions, thus affecting the market participants' ability to make rational decisions. As illustrated by the chart, we found several biases that could explain the behavior of market participants at different stages of the pandemic. However, due to time being a limited factor, we will only concentrate on fear. Fear is the one contiguous emotion that makes a person or group act irrationally. As so elegantly put by Bertrand Russell, neither a man nor a crowd nor a nation can be trusted to act humanly or think sanely under the influence of fear. During the pandemic there were 3 channels of fear transmission. The first is in the way the virus spreads, infection, and as highlighted previously, through the media effect. The third channel is through the news and information about the pandemic. Fear levels amongst the market participants were raised due to a number of factors as listed here. The fear levels rose in conjunction with the number of countries infected or infections deaths. Further, the nearer the Covid-19 pandemic got to the UK, the higher the fear levels were. It was not until the pandemic reached Europe that fear levels rose. The WHO's announcement on the 11th of March 2020 confirming the Covid-19 as a pandemic created a panic in the financial market. Since the pandemic status was a given, the panic could be regarded as a massive overreaction. The key to understanding this panic is not in the pandemic status, but the impact on the economy and financial status of organizations, which the fear of a significant adverse effect on the economy and hence financial state of the assets. Moreover, the fear of subsequent waves of the virus makes it even more challenging to stabilize the market. Another crucial factor in play is that the UK expected to formally leave the EU on the 31st of December 2020 in the mid of a possible second-third wave of the Covid-19 pandemic. The Covid-19 pandemic crisis was a lesson in the amplification mechanism and its effect on the loss spiral. The diagram illustrates how the pandemic affected the entire UK equity market. By early March, the impact of the Covid-19 pandemic had reached Europe. Thus, market participants were able to extrapolate the potential impact on the UK. However, market participants were in stale status due to the actions of the government as hinted earlier, therefore leading to an underreaction in the equity market. Furthermore, the market participants were in a state of denial or ignorance regarding the Covid-19 pandemic and its effect on the economy and financial market. The change came as the government, heeding the advice of a medical study by Imperial College London, opted for an increasingly stringent policy to counter the impact of the virus, thus leading to an upturn in the fear levels as market participants re-evaluated the effect of the pandemic on the economy in many listed companies' balance sheets. Additionally, as highlighted earlier, the statements of the Bank of England impacted on the financial sector, and hence the economy, increasing the fear levels still further. The market participants began to sell the financial stocks and the stocks with the highest affinity to the economy, leading to the loss spiral as in the diagram. The announcement by the WHO upgrading COVID-19 to pandemic status gave rise to a panic, and thus, as illustrated by the diagram, the amplification mechanism with the overreactions of market participants spilling over to other more secure assets. As highlighted previously, the critical factor was that many market participants knew the impact from other European countries on the economy and financial markets already. Moreover, the pandemic status of COVID-19 was a given. Yet the market participants panic, pointing to an overreaction to the information and events during the later stages of the COVID-19 pandemic crisis. We assume that a panic is any loss in market value over 10%. Hence, giving our assumption, there were only 3 one-day panics observed since 1984. The upgrading of COVID-19 to pandemic status on the 11th of March 2020 by the WHO is the most significant panic. The other 2 panics were associated with a single event, Black Monday, on 19 and the 20th of October 1987. As highlighted in the bottom diagram, although the global financial crisis of 2008 was highly volatile, yet based on our assumption it did not register a one-day panic in the FTSE 100. Over the first 6 months of the crisis, as observed by the upper diagram, the highest loss was the COVID-19 pandemic. However, there were 2 other with losses of over 30%. The first was the global financial crisis. Conversely, mainly due to panics on 2 consecutive days, Black Monday was the second. The key objective is that we looked at the lowest point in the aftermath of the event within the first 6 months. In summarizing, our findings suggest that market participants were in a state of ignorance or denial during the initial stages of the COVID-19 pandemic. This was partly due to the government reactions, which amounted to a keep calm and carry on approach. However, a major part of the underreaction was the lack of information on the virus and its impact on the economy. The change in policies by the government after the report by Imperial College London caused a hike in fear, which turned into a panic after the WHO upgrade of COVID-19 to pandemic status. However, we suspect that there was a massive overreaction by the market participants to the upgrade because by that time the pandemic status was a given. The advice of the Bank of England didn't help because it gave the impression that the banking sector was weak. The close affinity of the ongoing Brexit process to the COVID-19 pandemic relative to the event time conjuncture gave rise to the influence of Brexit during the pandemic. The fact that a potential no deal could still be on the cards is, to say the least, a worrying factor for market participants, especially with the potential impact on the UK's economy from a double impact of the pandemic and Brexit. A note on current states of affairs: there are a number of potential vaccines that have been tested and will be available within the next few months. The news of the successful testing created hope amongst the market participants and thus led to a market uplift. I would advise caution as to the hope. Firstly, the virus has the potential to mutate. Secondly, the vaccine only works for a period, and thirdly, the Brexit process could lead to a no deal. The model was successful in highlighting the factors and actors as well as the cognitive and emotional behaviors influencing market participants' decisions during the COVID-19 pandemic crisis. We extended the model of heuristics and biases to enable us to explain better the behavior of market participants during the COVID-19 pandemic. Moreover, the model does present a simple graphical top-level overview of the COVID-19 pandemic crisis. Furthermore, the model did explain the pandemic and highlighted the influence of the Brexit process. Finally, we are sure it could be extended to model any crisis. In concluding, we would advise all policymakers not to be restricted to the advice of a single group. The issue at the start of the coronavirus crisis was that the government listened too much to the advice of a group of behaviorists and did not heed the advice coming from health experts until late in the day. We also repeat our past advice: in times of crisis, policymakers should think how their communications or actions will impact the targeted community, that is, market participants, consumers, etc. The action or communication may be interpreted the wrong way. As of the 30th of November 2020, the total number of global cases and deaths were approaching 63 million and 1.5 million respectively. While it is not as large as the flu pandemic of 1918 to 1919, the COVID-19 pandemic is still a devastating health crisis. Finally, I wish you a Merry Christmas and the happiest of New Year. Please take care and stay well health-wise.